Hi, my name is Chad Grover, and I'm doing a speech on overdosing on acetaminophen. To persuade my audience that the FDA should listen to the recommendations of its advisory board and to urge my audience to keep better track of how much acetaminophen they consume. On June 29th and 30th of 2009, the U.S. Food and Drug Administration expert panel voted on several issues regarding acetaminophen. In the next few minutes, I will discuss why the FDA should adopt the recommendations made by the panel and why I will also urge you to keep better track of how much acetaminophen you consume. On September 19, 2002, Kate Trunk gave a 5-minute talk to the FDA advisory panel. She explained to the panel that Marcus Trunk wasn't a drinker and how his doctor had prescribed him a 10-day course of Tylenol. She said that when his prescription ran out, her 23-year-old son switched to the over-the-counter Tylenol for pain and then added Theraflu to the mix when he felt sick a few days later. He thought he was doing everything right until his life went horribly wrong. The autopsy said acute liver failure, acetaminophen toxicality. He died awaiting a liver transplant. According to the Harvard Women's Health Watch, each year overdoses of acetaminophen account for an estimated 460 deaths due to acute liver failure, 2,600 hospitalizations, and more than 56,000 emergency room visits. The FDA needs to take action and adequately warn its consumers of the danger of acetaminophen and how easy it can be to accidentally overdose. The leading over-the-counter analgesic in the United States is Tylenol. The leading cause of the acute liver failure in America today, according to a landmark study announced of internal medicine, is not alcohol or hepatitis, but overdose of acetaminophen. Acetaminophen is the main ingredient in pain relievers such as Tylenol and Excedrin, many popular sleep aids, and many over-the-counter cold and flu remedies such as NyQuil, Sudafed, and Therapy. There are over 300 products that contain it. Researchers at University of Washington Medical Center in Seattle found that between 1998 and 2003, the percentage of acute liver failure cases attributed to acetaminophen nearly doubled, rising from 28 to 51%. Severe liver damage as a result of overdose or chronic use of acetaminophen remains a significant clinical problem, accounting for as much as 40% of cases of acute liver failure. The name of Tylenol is closely associated with safety. It's used in hospitals and by pregnant women, so most people mistakenly assume it's okay to take in almost any amount. On June 29th and 30th of 2009, a joint panel of Drug and Safety and Risk Management Advisory Committee, Non-Prescription Drugs Advisory Committee, and the Anesthetic and Life Support Drugs Advisory Committee voted on issues after 2 days of considering ways to reduce the liver damage risk of acetaminophen, the most commonly used painkiller in the country. The panel voted 36-1 to recommend a black box warning prescription medication that combined acetaminophen with another drug. The FDA should follow the advice of the panel and make sure to include a strictest warning on prescription pain medications that combine acetaminophen, hydrocodone, oxycontin, or codeine. When treating flu symptoms, you should not take different medications that contain acetaminophen at the same time. Many products contain acetaminophen but don't prominently advertise this fact. A black box warning would help solve this problem. Meanwhile, less than overwhelming 21-60 majority voted to recommend that the FDA lower the maximum daily dosage for acetaminophen below its current 4,000 milligrams. Right now, the distinction between a safe and harmful dose is particularly narrow, and it can be toxic in relatively small quantities. The committee voted 24-13 to recommend making the 500 milligram pill available by prescription only. If the FDA adopts the recommendations of the advisory board, there will be a black box warning on all medications that combine acetaminophen with another drug. This will make medications that contain acetaminophen stand out more clearly You won't mistakenly mix 2 or more medications that contain acetaminophen and accidentally overdose. The maximum daily dose of acetaminophen will be lowered from its current 4,000 milligrams. To get a firmer maximum dose of 1,000 milligrams of acetaminophen, a patient will need a prescription, and therefore the patient's acetaminophen intake will be closely monitored by the doctor, so the chance of accidental overdose will decrease. If the FDA does not adopt the recommendations of the advisory board, people will continue to accidentally overdose on acetaminophen by unknowingly mixing 2 or more medications that contain acetaminophen. I challenge you to leave here today and educate yourself on the medications that you put into your body. If you do, it just might save your life. I'll leave you with a shocking fact. According to Dr. William Lee, acetaminophen kills more people annually in the United States than all other prescription drugs combined. This is why the fact that it is over the counter is sold in quantities of 1,000 tablets and has been advertised for years as being remarkable safe doesn't make sense. I urge you to think twice the next time you are sick and want to take a few extra strength Tylenol and NyQuil to help you sleep. Take a minute and add up the milligrams of acetaminophen. It could save your life. I encourage you to take action when you go home today, or go to your medicine cabinet and see just how many of your medications contain acetaminophen. I have. If you don't, you just might end up like Marcus Trump.